Hi everyone, I am Dr. Himadri. So today our topic of discussion is short stature. Actually, this is very important topic in pediatrics. So in this video, actually we have two parts, part one and part two. In part one, we will be discussing definition of short stature, anthropometry, followed by the etiology and the causes of short stature. In part 2 of the video, we will be discussing the actual clinical approach to a case of short stature. Initially history taking, followed by examination, then investigation, then the treatment part of it. Okay, let's talk about short stature. So what is the definition of short stature? Definition of short stature is when the height for age is less than third percentile or less than -2 standard deviation, we call it short stature. So for telling short stature, we need to plot the height of the child in growth chart. So there are two types of short stature. One is physiological short stature and another is pathological short stature. So physiological short stature means when the height for age is usually from -2 standard deviation to -3 standard deviation and the growth velocity is normal. Growth velocity means when the growth velocity is more than 4 centimeter per year. And the pathological short stature is when the height for age is less than -3 standard deviation. Usually we call it pathological short stature. And another thing is the growth velocity is always less than 4 centimeter per year. That means when you will plot it in the curve, you will find that the curve is either straight or downwards, not upwards. That is it. So we need to do anthropometry for the child, and in step 1 we should measure the length or the height of the child. So the length is measured up to 2 years of age and the height is measured after 2 years of age. So up to 2 years of age, we measure the length by infantometer, and height measurement is done by stadiometer. The child, then the child should be standing. So in infantometer, at least 2 persons should be there to measure the length of the child. So one cardboard should be placed at the head end, and the child's head should be made in the straight line, so that the Frankfurt's plane and the cardboard which is present above the head should be in parallel. And also the another person, there should be a pressure given at the knee joint so that it touches the underneath surface, and another cardboard is placed at the foot end, so we can get the actual length measurement of the child. So in case of height measurement, the child should be standing against a wall, and the back side of the foot should be touching the wall, as well as the buttock, the scapula, and the back side of the occiput should be touching the wall, and as well as the child must be looking straight. That is, the Frankfurt's plane should be parallel. That is, actually the Frankfurt's line is when the lower portion of the orbit and the external auditory canal, that is the tragus, we have a straight line. So this is called as the Frankfurt's plane, and this plane should be parallel to the line which is present above. That is the child's head above, it should be parallel, as well as when we make a line this direction, there should be actually the 90 degree. You can see the picture very well. Now let's talk about the normal length parameters. You can measure the length, but the normal length you should know. At birth it is 50 centimeter. Just remember, at 4.5 years of age, the length actually becomes double, that is 100 centimeter. At birth there is 50, at 4.5 years of age this is 100. At 1 year, 2 year, 3 year and 4 year we should look like 50. You must add the half of 50, that is 25. And in the second year you just add half of 25, that is 12.5. So 50 plus 25 for 1 year, for 2 year 50 plus 25 plus 12.5, for third year 50 plus 25 plus 12.5 plus 6.25, and after that 3.12. You know this. So just remember two things: at birth 50 centimeter, at 4.5 years of age this is 100 centimeter. This is the normal length. This is normal. So the step 2 of anthropometry, we should measure the height velocity. To measure height velocity, a single value, in a single value you just can't measure it. You must have the follow-up of this patient. So initially when you are calling the patient, you must call it after 3 to 6 months and should measure another point and plot it in a growth chart, so that you will get the height velocity. So look here, within the first year there is the highest height velocity, about 25 centimeter per year. But 4 to 10 years of age, there is you can look in the curve that this is gradually going down 5 to 10 centimeter. And before puberty there is pre-pubertal height in case of girls as well as in the boys. This is usually 10 to 15 centimeter per year. So another very important thing, the minimum height velocity should be 4 centimeter per year, and you should measure at least 3 to 6 months interval and plot it in the growth chart. So look here, this is our growth chart. Step number 1 is measurement of height or length. Step number 2 is height velocity measurement by multiple values. And step 3, you have to plot it in the chart or the growth chart. Look here, this is WHO growth chart. Blue is for the boys. Probably blue is the favorite color for boys, that's why WHO given this. So this is a third centile. Third centile is equal to -2 standard deviation, and the short stature, we call it short stature when this is less than third centile or less than -2 standard deviation. So this is short stature. I am plotting a 6-year-old boy having height of 82 to 83 centimeter. So just like that. In case of girl, look at this. The pink is favorite color probably for the girls, mostly. WHO recognize it as well here. So I am plotting multiple recordings here. Look at after 3 to 6 months interval. Suppose the line goes like this. So if we join all these lines, it will become a straight line. The very important thing is that the growth velocity here is less than 4 centimeter, because if the curve is like straight or it is downward, by default the growth velocity is less than 4 centimeter. If it is going upward, which may be parallel, even if it is parallel, now look at this. This is parallel to the third centile. The growth curve, this is parallel to the third centile, but below third centile, the growth velocity is now this is physiological, because the growth velocity is more than 4 centimeter. Growth velocity is more than 4 centimeter here per year. So after you have this growth velocity concept, now in step 4 we should know the mean parental height. MPH means mean parental height, that is father side plus mother side divided by 2 is the mean parental height. So the target height should be mean parental height plus minus 6.5, plus 6 for boys, minus 6 is done for girls. So now we have to plot it in the IAP chart. Look, up to 5 years we must use the WHO chart. More than 5 years, 5 to 18 years, we have IAP chart. So IAP growth chart we have to follow it. So look, there is percentile calculator for mean parental height. At 18 to 20 years of age, the child must attain the target height. What we got from mean parental height, plus 6.5 for boys, minus 6.5 for girls. So we have target height. By 18 to 20 years, the child should attain it. So that is how we must measure the mean parental height and mark it. And in defined settings, we must monitor the growth curve. So after this, in step 5, we have body proportion assessment. Body proportion is assessed like upper segment and also the lower segment. Okay, so till pubic symphysis, from up to pubic symphysis, this is upper segment and the lower segment is below this. To measure this, best way is to put the child over a stool and measure the total height and also subtract it the length of the stool from it, so that you can get the upper segment and lower segment very well. So the normal values at birth, 1.7:1 at 3 years of age, 1.3:1 at 6 years of age, 1.1:1 at 10 years of age, it becomes 1:1. But in case of adults, please remember this, upper segment is to lower segment ratio, it is 0.9:1. So another thing is very important, that is arm span. Arm span at birth, always the length or height is more. The length is more than the arm span. But in case of adult, the arm span is more than length. You must know this. And at 11 years of age, the arm span as well as the height becomes equal. Okay. At step 6 of anthropometry, we must know the SMR, that is sexual maturity rating. So I forgot to tell you, from upper segment to lower segment ratio, we have the concept that is proportionate short stature or disproportionate short stature. We can actually comment on it. Proportionate means when for age it is appropriate, the upper segment and lower segment ratio is maintained, this is called proportionate. When for the age of the child this is not maintaining, this is disproportionate. From disproportionate we have two options, we will discuss later on in the pathological short stature. So the sexual maturity rating is for the secondary sexual characters. For males, the height, growth spurt. For females as well as the growth spurt, pubic hair development. And for females, there is menarche and thalarche. For males, we look for the testicular enlargement as well as the penile growth. So look here, in the tenor stage, we have total 5 stages. At first we are looking here the breast development. You have to remember one thing, that is, look here, here we can make out the breast as well as the areola. Breast and areola in stage 1, that is pre-adolescent. In stage 2 it's like a small mound. In third stage, breast as well as areola is present, it is increased from the size is increased, but there is no separation. You have to remember one formula, that is 4S. S for separation. At fourth stage there is separation from areola, that is the breast tissue and areola get separated. So the formula is 4S. In stage 1, that is pre-adolescent. Stage 2, it's like a small mound. Stage 3, further development. But in stage 4, there is separation between the areola as well and the breast tissue. And stage 5 is totally mature adult breast. Now the pubic hair development in female, you have to remember one formula, 3C. 3C, you know, A, B, C. C is in the third position, so 3C. C means curling of hair. From third stage there is curling of hair. From fourth and the fifth stage, another thing, the fifth stage you must know that the pubic hair gradually increases in size, but in the fifth stage the inner aspect of the thigh, there is the spread of the hair in the inner aspect of the thigh. So in case of male, there is stage 1, 2, 3, 4 and 5, the same. But here we have another formula, which is 3P, that is in the third stage there is penile enlargement. In stage 1 and stage 2, not much penile growth, but from stage 2 there is a darkening of the and a wrinkling of the skin of the scrotum. In the stage 3, you have to remember that is 3P. So 3C, 3P and 4S. 3P means from the third stage there is penile enlargement as well as the much more rugosity in the scrotal skin. In the stage 4, the hair also increases and also the more penile enlargement. In stage 5, it's like total adult size. And another thing, the hair grows towards the umbilicus. In case of female, the hair grows towards the thigh, but here the hair grows towards the umbilicus. That is the main difference in stage 5. Okay, now let's talk about physiological short stature. So we talked earlier that there is two short stature, physiological short stature and pathological short stature. In physiological short stature, we have two examples, constitutional delay and familial short stature. So what is constitutional delay? Constitutional delay means there is a delay in the growth of the child initially, but when the age of the child increases, eventually the child attains the target height. So there is look here, the normal growth till 6 months to 1 year of age. Then there is catch down of growth at 1 to 3 years of age. Then after 3 years, the growth is below the third centile, but it becomes parallel to the third centile. Below the third centile, but it is parallel to the third centile. You can see from the curve. And after that, So at that time the growth velocity is more than 4 centimeter per year. That is a normal growth pattern. But after years, the child gradually reaches the target height, that is, it crosses the third centile line and goes above, and it becomes more than third centile, that is, and reaches the target height, target mean parental height. So here there is delay, so you can see that bone, the chronological age is more, bone age is less in case of constitutional delay of growth in growth and puberty. So this is the blue line, you can see, till 6 months to 1 years normal, then catch down growth, then parallel to the third central line but below it, and after that it reaches the mean parental height. In case of familial short stature, there is normal growth till 2 years of age, then there is catch down growth, and but then there is catch down growth, but the child's growth becomes below third centile, but it is always parallel to the third centile. In familial short stature means mom is short, father is short, therefore the child is also going to be a short because of some genetic cause. So the mean parental height is always less than third centile. So let's now you try to tell what it is. This is physiological, two examples of physiological short stature. I will be drawing it, please tell what it is. So initially the growth was normal till 6 months to 1 year of age, then catch down growth, then parallel to the third centile, then eventually reaches the mean parental height which is above it. So the first example, this is constitutional delay of growth and puberty. But the second example, after 2 years of age, there is catch down of growth and eventually it becomes parallel to the third centile but always below it, and mean parental height is also below third centile. The second option is familial short stature. In constitutional delay of puberty and growth, the chronological age is always more than bone age. But in familial short stature, familial short stature is like a mini Xerox copy. Look at it. It's like a mini Xerox copy. Your bone age as well as the chronological age is always equal. So you have to know the chronological age, bone age as well as the height age. Three things you should be knowing. Here the chronological age is in case of constitutional delay, this is more than bone age, but bone age is equal to height age. But in case of familial short stature, chronological age and bone age is always equal. It's like a mini Xerox copy, and height age is less than the bone age because the child is less than third centile. Okay, so in pathological short stature we have two types of two defined entities inside pathological short stature. One is proportionate short stature where the upper segment and lower segment ratio is same, rather this is normal for the age, and the disproportionate short stature where the ratio is not maintained. So inside disproportionate we have two things, so short limb short stature as well as short trunk short stature. So now let's talk about the pathological short stature, all the examples. So pathological short stature occurs in chronic conditions. Usually the most common is chronic malnutrition, that is protein energy malnutrition, and some chronic illnesses like cerebral palsy. If there is cerebral palsy, there will be the once again malnutrition associated issues, all those things. And in case of asthma, in case of cystic fibrosis, congenital heart disease associated with the failure, and also malabsorption, that is celiac disease, all these things. And endocrine cause you must be knowing, there is hypothyroidism. In case of hypothyroidism, in case of hypopituitarism, Cushing syndrome, and also pseudo hypoparathyroidism, all these things. And some syndromes like Down syndrome, Turner syndrome, and Noonan syndrome, Prader-Willi syndrome. And due to IUGR, that is small for gestational age babies, there is primordial dwarfism, and due to some psychosocial issues, there is psychosocial dwarfism. Psychosocial dwarfism is like when the environment of the child where the child is growing is not psychologically suitable for the child. So let's talk about the examples of proportion and short stature. Look, if there is chronic malnutrition, the upper segment and lower segment, both the segment will grow less, so that the height, it's a chronic condition, that's why the height of the child is less. So the example should be chronic malnutrition, that is protein energy malnutrition, and chronic illnesses, you know all those examples like cerebral palsy, or it could be asthma, or it could be cystic fibrosis, congenital heart disease, or malnutritions like celiac disease, all these things. And another thing which is very very important, out of all endocrine cause, at least one cause you should know that have proportionate short stature, that is hypopituitarism. Very important question which is asked in multiple choice questions as well. So let's talk about the disproportionate short stature. We have short upper segment short stature as well as short lower segment short stature. So short upper segment short stature, we have a formula for this. It's like a small TV, SMTV. Small TV is spondyloepiphyseal dysplasia, and M for MPS, mucopolysaccharidosis, and T for TB spine, and V for hemivertebra or vertebral abnormalities. You can understand all these things as there is some issue in the upper segment, mainly in the vertebra. That's why the upper segment is becoming shorter. So in case of short lower segment short stature, we have a formula here, mnemonic to remember this. It's like hormone replacement therapy, HRTA, that is hormone replacement therapy A. Okay, H means here hypothyroidism. In hypothyroidism there is short lower segment short stature, and R for ricket, and T for here your Turner syndrome, and A for achondroplasia. So hypothyroidism, ricket, Turner syndrome, and achondroplasia. Two formulas, small TV and hormone replacement therapy, HRTA.